Okay. So, doctor, we are Vikas is there,
Mhm.
and he want to ask something. So, if you allow, then I can invite him.
Sure.
Hello, doctor. Good morning.
Morning.
Yeah. My question is, my father has a stroke recently and developing a weakness on his left side, and he was told in in schema stroke. And what
It's
can changes are happening again, and how can I prevent the another stroke?
So you said like your father had an ischemic stroke.
Yeah.
Okay. So again, there are like stroke. We have different categories. Different subtypes of stroke. One is ischemic stroke. One is hemorrhagic stroke. Ischemic stroke is more common, which is due to a blood clot in the blood vessel, which stops the blood flow to a particular part of the brain tissue and causes, the tissue dies, and it will cause those problems, and it will have problem moving the left side, right side based on what area of the brain is affected. So in your father's case, I'm sorry that he had has to go through this and had this stroke. But the more important thing is to prevent another stroke. Once the stroke happens, there are like different treatments based on when you go to the hospital. What we recommend is to go to the hospital as soon as you start to see some symptoms, because there are certain acute treatment options where you can actually help, or sometimes you can reverse the stroke. What is called as a clot busting medication, which can be given in a timely fashion within like 4.5 hours. And if the clot is there, if they check, if it comes within like 24 hours, you can also be eligible to get a clot retrieval. Like they go through a catheter, and they go into the brain vessels and they pull the clot out. So those are the acute treatments. But once the acute phase is over, what we can do is prevention of another stroke. What it entails is to put them on the right medication based on what caused the stroke. If it is because of a small blood vessel occlusion, then we treat them with antiplatelets like aspirin and Plavix. If it is because of something coming from the heart, like a clot, we put them on a medication like a blood thinner, like Epixaban, Lovenox. I mean, there are certain blood thinners. If it is because of a carotid, plaque or a cholesterol plaque here, we put them on medications to prevent it, like a statin and aspirin and Plavix. Sometimes if the plaque is so severe that it narrows completely your carotids, then we do offer surgical procedures like carotid endarterectomy and carotid stenting, where you facilitate the blood flow to the brain. So there are various procedures, and for all this, the prevention is the most important thing once you have a stroke. And for that, we put the patients on appropriate antiplatelets, on also educate on aggressive vascular risk factors like high blood pressure control, cholesterol control, and if your father has a sleep apnea, I would highly recommend him getting evaluated for the sleep study, because that is most undiagnosed condition globally, which indirectly causes all of the risk factors and can cause strokes too. And the more, for once you have a stroke, the recurrence is high, and it averages anywhere from 5 to 50%, but it depends on what type of stroke it is. If it is a small vessel stroke, recurrence is less. Large artery atherosclerosis, what I was talking about is the carotid artery, and the cardioembolic. What it means is, stroke coming from like clot coming from the heart. These two subtypes of etiology is a higher recurrence risk. So I would try to aggressively manage vascular risk factors so that we can prevent another stroke. Does that answer your question?
Yes, sir. Thank you for your sir, consulting, sir.
Thank you.